We're here with Dr. John Boyajian, the founder of Sinus Center, Idaho, who has over 20 years' experience helping patients with nasal sinus issues. Today we'll talk about the reasons for sinus surgery and what it can and cannot do. When is sinus surgery considered?
Nasal sinus surgery is considered when patients cannot obtain and maintain control of their sinus problems with medications. Everybody gets nasal sinus problems, but 9 out of 10 of us, it's not a problem. For 1 out of 10 of us, it's a serious problem because medicines don't work. The reason why medicines don't work usually is because there's something structural in the nasal sinus area that prohibits the medicines from giving the relief that most of us enjoy. That's why sinus surgery is considered.
So it sounds like you're referring to an anatomical issue. Is that the case?
Anatomical issues that prohibit airflow and mucus flow, hence prohibiting the successful treatment with medications.
Would a sinus surgery provide a cure for a person who suffers from chronic sinus problems?
Absolutely, 100% no. Most sinus patients, again, have relief with medicines. But a chronic patient has a battle that goes on between them and their nose and sinus membrane. Their nose and sinus membrane and the world don't like each other. That's a battle surgery cannot win. Surgery is done to give good structure of airflow and mucus flow so you can take medicine into the battle and hence be in control and win that battle. When I counsel a patient, I always give them 3 choices, and there will always be 3 choices. Number 1, you don't have to do anything. You can live with sinus problems. You have, and you can still do it. You can continue trying to find a relief with medicine. You can't take antibiotics and prednisone tablets forever. They have serious side effects, but you can search and try many, many different medical remedies. And surgery is an option that's gone over along with those other 2. I never try to recommend to a patient what they should do. I try to give them the information that they can make their own decision. However, some patients, when you talk about surgery, they feel that that's your recommendation. My recommendation is for patients to gather the information as best they can and make their own decision. I've done that today, yesterday, and I'll do it tomorrow.
You often talk about how patients are sick of being tired and how their constant illness affects their sleep and job and everything. Can sinus surgery break that cycle?
Most definitely. The sinus patient, the chronic sinus patient, suffers not only the physical down of being sick, but there's an emotional thing that goes with this. Nobody believes them. Family doctors are very good at getting people better with nasal sinus problems. It's the problem, however, is with the 1 out of 10 patients that do not get better. Doctor says, geez, all my patients get better, but you don't. I don't know why. Almost blaming the patient. So that patient leaves pretty much disenfranchised, not knowing what to do. So not only do they feel bad physically, but now emotionally they're upset. So that's a bad combination for enjoying a quality of life. And hence, when their quality of life is restored, they have this great feeling of thankfulness, and with their well-being restored, they can now enjoy a quality life.
When someone with this problem does get sinus surgery, their whole world can change.
Well, they're back in control of their life. Nasal sinus problems start taking over. You don't do things because you get sick if you go there. If you do this, you get sick. So you get to be pretty much a slave to your nose and sinus, pretty much predicating where and what you should do and when you should do it and with whom. And when you think of it like that, it can be overwhelming. I mean, they've done studies that show sinus patients' quality of life are affected as bad or worse than people that have heart problems, asthma problems, back pain, all the debilitating injuries that we are aware of, but we don't put sinus in that same category. But it is. It's pretty amazing through the years. Patients absolutely break down and cry because now they have a new life and they're back in control. It's pretty interesting to see how impactful improving their sinus health can be to a patient's quality of life. It's something that's always surprising to me, even though we do it almost daily.
How has sinus surgery changed over the years?
Well, unfortunately, as you get older, you can answer those questions with some degree of accuracy. I've seen nasal sinus surgery go from hammer and chisel and 4 or 5 days in the hospital with packing in the nose for 10 days to 2 weeks to now an outpatient procedure with no packing and much more accurate surgeries that can extend into areas that we never even dreamed of in the past. So there's no question that technology and surgical technique has helped sinus patients improve their quality of life.
That sounds like today's techniques are much more gentle. What kind of pain or discomfort is involved, and how long would it last?
Well, pain is personal, and everybody has their own pain level and own tolerance. But I've done many surgeries on patients. Most patients use pain medicine for that night after surgery, maybe the next day. Um, some patients need a little bit more, but pain medicine use is pretty minimal.
How long might someone need to take off work to have a surgery?
Taking off work is pretty much predicated on what kind of job and what facilities they have at work. Again, most people do not need pain medicine after a day or two. However, they're with no packing in their nose. They have to irrigate their nose with a saltwater bulb syringe solutions 4 or 5 times a day the first week. And that means that once or twice during that day at work, you'll probably have to irrigate your nose. My guess down at the restaurant, they don't have a place for that to be done, nor would they like you to do it. But I'm also quite sure that some patients have the facility and ability to do it. So it's really whether or not they can do a nasal irrigation at their place of work.
How many times do you see a patient after a surgery is done?
That's a good question, and most people don't ask that. And throughout the country, that follow-up is all over the board. But I have a specific belief that all surgeries take about a year and a year and a half before they're totally healed. So our regimen has been the same since day one. We see postoperative patients 1 week, 2 week, 1 month, 2 month, 6 months, 1 year. At 1 month, we do a nasal endoscopy. At 6 months, a nasal endoscopy, and at 1 year, a nasal endoscopy. So we see how their healing is before they're discharged from the clinic.
It sounds like you have a really good grasp of how your patients have fared after surgery.
Well, a lot of patients think that that's a pretty laborious regimen to go through, and some follow through and some don't. But again, the battle of nasal sinus is not the surgery in itself, it's how the nose membrane and the world get along. And there's 4 seasons. And so following a patient 4 seasons after a surgery, I think, is what should be done. Now, it's not the standard by any stretch of the imagination, but it's my personal feeling.
What about sinus surgery that might need to be done more than once? Does that happen very often?
Nasal sinus surgery, repeated, has to have a little definition. People with nasal polyps will always have a polyp return. Whether or not it's a surgical problem depends upon the medical treatment and how soon the patient can get medical treatment. The revision rate of scar tissue and various sundry things is improved greatly through the years, reducing from 30 to 40% revision rate down to, in our practice, it's 7%, where surgeries have to be done to clean up or get rid of a little scar or something that's not quite right. So it's not as frequent as it used to be, hence probably the question, but it still has to be done occasionally, as is all surgeries have some revision rates.
What are nasal polyps?
I don't know. I don't know. Polyps are a membrane problem that we don't know what causes them, and we don't have a cure for them. Why do some people get them? Why do other people don't get them? Why does one side of the nose have a polyp? Why does the other side not? Polyps have different shapes, different consistency. They can look like a grape. They can look like a grape combination with a muscle or meaty look appearance. They can be big, they can be small, they can be clustered, they can be just like a grapefruit on a tree. They come in all sizes and shapes.
So they're little growths in
They
the
can be
nose.
little growths, big growths, like a cluster of grapes, or it can be like a great big grapefruit on a tree, or
And do these grow in the nose or in the sinuses themselves?
both. Nasal polyps. The good news about nasal polyps is they don't have the cancer scare like colon polyps. Nasal polyps can be often remedied with medications and do not need a surgery. Colon polyps always need a surgery. Colon polyps don't come back once they're removed. Colon polyps have no medical remedy. Nasal polyps always come back. It's not if, it's when.
What should people know about balloon sinuplasty?
Balloon sinuplasty, well, it's gotten a lot of publicity for the last, I don't know, 10 years or so. I was the first one from Idaho that took the class. The technology has improved quite a bit. It's got the whole nasal sinus world abuzz. Kind of two camps seem to be forming, those who use it for everything and those who use it as a tool to help us get into a sinus area safely. It's not magic. It's not kind of what it's being marketed as, but it's a good tool. There's some difficulty in some areas, in some hospitals, and some insurance companies do cover it, some don't cover it. It's not magic. It's just a tool that helps us get into a sinus. Unfortunately, it's been marketed as kind of the cure for nasal sinus problems. It's not. It's a good tool to get into a sinus that's difficult to get into.